the COVID pandemic has really shown some gaps in our healthcare system and our public health. That's why I introduced House Bill 1152, which is a governor request bill. And I think what's important about that is it regionalizes our health districts. And we really are still working on the policy to develop it, but it'll make sure we have a more coordinated strategy that is state supported, that is regionally coordinated, and is locally implemented. And so there's a lot of discussions on that. I also have been very aware, particularly in Spokane, what happens when politics infects our public health system. So I introduced House Bill 1110 to put more medical professionals, public health professionals, tribal representatives, business members, consumers, people with lived experiences to balance our health boards. We don't think politics, and I don't think politics should infect public health. And we want to bring that balance back to make sure that medicine and science are leading in this time of crisis. Finally, because of the pandemic, we've seen the emergence of telehealth and the importance of providing access for all people. I think particularly we like when people can connect via video, but that's just not possible in some of our rural and underserved areas. As we work towards digital equity and health and education and all things, really, we've realized some folks have been left behind. So I introduced a bill, House Bill 1196, to add payment parity, which allows services to be reimbursed for audio-only telehealth services. We've seen that's been critical, particularly with our folks getting substance abuse counseling, mental health counseling, and making sure that we have access in all parts of our state. I don't think it's a mistake. I think this is the exact time we should be looking at our public health systems. We certainly need to look at how we're funding them. This isn't a Democrat or a Republican issue. We, the legislature, have woefully underfunded public health, and public health is our first line of defense. So it's really important that we take a step back during this time to evaluate where those gaps are in the system so we never let this happen again. We've let our guard down. So we need to provide the structures that make us have an efficient public health system. We also need to make sure that we're adequately funding public health, again, so that we can deliver in a way that is state supported, regionally coordinated, and locally implemented for the best health outcomes.